Okay, so this is kind of a different video. I had planned on a couple different topics on this video, but I have to kind of limit it to really two, and I'll explain why. It is confirmed that this coming Monday, October 17th, I am going in for surgery. So that was confirmed about 3 weeks ago through the surgeon. So I'll be going in to have that done. And I'm going to tell you what I'm going to have done. And you can look this up. I'll put a description below about exactly what this is. And it's a robotic laparoscopic assisted hiatal hernia repair. And a short answer to that is what it is you have underneath your lungs you have a diaphragm between your stomach and your lungs, and through that diaphragm your esophagus runs down. There's a sphincter at the top of your stomach, well, on the diaphragm that where your stomach and your esophagus meet. That opens and closes as you eat. Over a period of time or age or whatever, and there's different things that cause this, that sphincter valve gets loose and it allows the top portion of your stomach to protrude up through your diaphragm, which is what a hiatal hernia is. The result of that is you get acid reflux. And acid reflux is just a wicked case of heartburn. But what that does is your esophagus, first of all, what it does is it allows the digestive juices, which is partially hydrochloric acid in your stomach, to come up through your esophagus. So basically what I have to do is I have to sleep on my left side because the way your stomach is positioned, it's below your esophagus and throat and everything, and kind of stops that gastric juices from coming up. Now, over a period of time, what that does is because your esophagus was not made to handle those juices, you get what you call Barrett's esophagus, which is what I have. I had an endoscope about a month ago. They determined that I had Barrett's esophagus. What that does is that alters the cell in your esophagus to what they looks like intestinal cells. Now, you can get cancer from that. There was determined to be nothing cancerous, nothing precancerous. But over a period of time, if those gastric juices washing over your esophagus, you can get it. So it's only a matter of time that I would have to have that surgery. I'd rather have it now than 10 years from now, whatever. My lung cancer diagnosis is still negative. I've had 2 CAT scans. The third one I have coming up in December. Those have all shown negative, so that is, I'm assuming, is going to be probably gone. I think if the December one shows it's negative, I really don't have anything to worry about. Then I have one more next June, so I'll have 4 in 2 years. But this will repair that. And again, I'll put a description below exactly what that is. It's supposed to be 1, maybe 2 days in the hospital. And then really after that, the first week is a activity restriction. I can't lift over 5 pounds because they take the top part of your stomach and they wrap it around your esophagus and stitch that in so it can never come back up. Same thing when they close that opening a little bit. They put a tube down your throat so they don't close your esophagus off altogether when they stitch in that, or you wouldn't be able to eat. But the first week is basically activity restrictions. I can't lift anything over 5 pounds. I have to just kind of take it easy. Week 2 through week 8 is a food restriction. I can only have soft type foods, foods that require almost no chewing, stuff like mashed potatoes, mashed squash. Originally, this surgery was going to be in January, but I didn't really want to wait 4 months. I have to think about it for 4 months. So my surgeon, who happened to be the same surgeon that did my cancer surgery, does this particular procedure. Same thing with a robot and everything like that. So I'm confident in her abilities because I know what she did for me in the past. But it's, with Thanksgiving coming up and Christmas, I was like, I don't want to deal with food restrictions. But I looked at the food restriction list, and week 2 through week 8 is, like I said, soft food. You can have mashed potatoes. You can have squash that's mashed. You can have pulled chicken. So I'm assuming you can have pulled turkey too. It's kind of the same consistency. But I'll have to ask the nutritionist because I'm sure there'll be a nutritionist that'll come into my room like they did last time and talk about my diet and what I can eat, what I can't eat. And then after week 8, you can kind of go back to normal eating. They want these, whatever they're going to do to heal within 2 months. So I'm not sure what my activity restrictions are after the first week. I don't think there really is any. I'm sure there's going to be some, but probably not like the first week where it's kind of severe, where I really can't do a whole lot of anything. So, anyway, so I thought I'd put that video out because my plan was to review this thing I have behind me. I don't know if you can see it. I'll change the camera. Which is this super handy 20-ton, is that in the picture? 20-ton hydraulic wood splitter. So you can see that it's down. You know what that kind of looks like. I bought that online from Tractor Supply about, I'm going to say 3 weeks ago, and they delivered it last week. Now the problem was when I ordered it, it kind of skipped through the warranty process of it. I wanted to get the 2-year warranty on it because it is hydraulics, and you got to put this thing all together. And I wanted to make sure that I was going to have at least the warranty because I knew for the amount of time that I was going to be using it before surgery. Once I used it this week, it was going to be put up for probably January at least. And the warranty on it's really only 30 days. So I don't really only have a week's use out of it. Then it was going to sit for several months. So when I called corporate to Tractor Supply to find out about just buying the warranty, they said, well, they can't do that. Take it back to the store, have the store manager return it, and then repurchase it with the warranty. So last week, I did that. I didn't take the unit in. I called them on the phone first, and they said, no, just come in. We'll do it, right here. So I went in. They can return it, but when they tried to rebuy it, there was no option for the warranty. And it just so happens that the day that I bought it online was the last day that Tractor Supply offered this particular wood splitter for sale. So there is no option to rebuy the warranty. Now, and they tried for about an hour to put to make up a SKU, to put a SKU in there for the warranty. Nothing worked. And finally they said, we can't do it. It's just not allowing us to do it. So I'm going to take this back to Tractor Supply today. You can see I haven't opened it. It's still in the box. So I'm going to take it back to Tractor Supply today, get my money back, because I'd really only be able to use it now for, what's today? Today is Tuesday, so I'd only be able to use it today and Thursday. Friday is going to be rain, and then the weekend, and to hold on to it for, a month, 2 months without even using it with no warranty is just crazy. Then I actually found out I could get this on Amazon for $200 cheaper with the warranty. Without the warranty and tax, this thing came to about $1,000. Amazon had it for about $800 with the 2-year warranty. So after I recover from all this, probably end of December, I'll probably repurchase it. Because if you watched any of my videos last year, we had a big, huge oak tree that came out in the back, and we had that all cut up. Since then, we've had 2 other trees, and I'll see if I can find the video because I did shoot the video on the garage side of the house that came down. Okay, so this is part of the trees that came down. See, I cut most of this one down. I have this section here I'm going to cut down to the bottom, and then that I've got to cut down. This tree here is probably going to end up coming down this winter. I cut some of the dead branches off of it, but I'll just wait till it falls. It's probably going to fall down, but I got to get this cut out, so at least there's no more leaves covering this roof and stopping it from, drying out when it rains. So I'm going to cut the rest of this down today. And I've got to figure out a way. You see how the root is growing kind of into the side of the building here. We got to figure out a way to fix that. Down. I've said cut those up, and we need a way to split the wood from those, because we do want to save that oak. It's good hardwood, to use in a fire pit or in our coal/wood stove. So it looks like the work on this, on the Springer, that looks like that's not going to happen now till about, I'm going to say January. I was hesitant about buying a new lift table because I knew I wasn't going to get much use out of it right away. And all the work that I need to be done, I can do, on this jack right here. So if I order a lift table, it's probably not going to be for July, because I do need to take the heads off that and the exhaust off. I've already worked on the front end. I wanted to take the bike out for a test to test that front end, but I don't really want to get the bike out with a couple of days before surgery. If I go down or if something happens, that's going to postpone my surgery, and I really don't want to postpone it. So, all right, so that's going to be it. I might do one more video before I go in the hospital. Me and my wife this past weekend, Columbus Day weekend, we went to Stowe, Vermont, and she wanted to go look at leaves. Although we have plenty of leaves around here, you know, she wanted to go up in the mountains. So we spent Saturday, Sunday, and came back yesterday on Monday, and spent you know, a couple of days up there. And I'll talk about that trip, and I do have some video on that and some still pictures and everything like that, so I'll talk about that. So, all right, so I will see you in the next video. Don't forget to subscribe, leave me some comments. Have you ever had this surgery that I'm having? Leave me a comment below. Let me know what you thought of it, what the after effects were of it, and I will talk again in a video. Probably this weekend I'll release another video before I go into surgery, and it's probably going to be, you know, a few weeks before I do another one after that. Thanks for watching, and I'll see you next time.